After a surge in daily COVID-19 cases, Cuba's Prime Minister announced new measures to contain the virus.
The measures must focus on a significant restriction on mobility of vehicles and persons. I reiterate that we can have all the vaccines we need to immunize everybody, but that must go hand in hand with a drastic reduction of mobility.
Authorities also announced further restrictions like adjusting shop hours and other services, tougher control measures at airports, while all provincial borders are closed. Currently, Cuba has more than 197,000 confirmed cases and more than 1,320 deaths since COVID-19 was first detected on the island in March 2020. The surge in number of daily cases over the past 2 weeks sounded the alarm.
We Cubans have favoured this spread. We have disregarded safety measures. Add to this the strong impact by new COVID variants, affecting not only vulnerable adults and the elderly, but also the children.
The COVID-19 outbreak occurred as health authorities continued to help with locally developed candidate vaccines in an effort to contain the spread. More than 1 million Cubans have received at least one shot of the locally developed vaccines, while more than 500,000 have been fully immunized.
We must take much care of our children and keep them at home. That's the first thing to do, because this is a tough situation, and all I hope is that we get over it once we get vaccinated.
Cuba has begun clinical trials on children, while 2 of the 5 local candidate vaccines proved efficacy levels high enough to be considered effective vaccines. Cuba's health authorities are expected to approve emergency use of local vaccines to combat the latest spread of the virus, which is key to return to normalcy. Chirino, CGTN, Havana.